Hey guys, this is Dr. Bradley. Today we're going to talk about an exercise called the horse stance vertical. This is a beginner exercise, but it's an excellent exercise for rehabilitating the lower spine or the lumbar spine. So whether or not you have just gotten out of a surgery and needed to start strengthening your low back, or maybe you've been injured recently, or maybe you've just been suffering from chronic low back pain. In either of these scenarios, this is an excellent exercise to start strengthening the lower spine, particularly the smaller core intrinsic muscles like the multifidi and the transversarii, muscles like that. And then it's also going to strengthen up the glutes and the lats and muscles that should work synergistically together. So I'm going to move to the exercise now and show you how to do the exercise properly and describe it.
All right, so now we're going to show you how this exercise should be done. You want to have the patient get into what's called a 4-point stance. And you want to make sure that their leg, the femur, and the arm are perpendicular to the ground. So I want Joshua to bring his knees closer to his body. Bring your knees up a little bit more. A little bit more. Okay, now we want to make sure that we have a nice arch in the spine. We don't want to have an excessive arch, but we also don't want to have no arch at all. We don't want to let the patient round their back out. Okay, see if you can move this way a little bit. I'm going to use a stick to put him into a good alignment. Okay, and this is good actually. So you see how the stick is touching the back of the head, the mid-back, and then the tailbone. And if we use this spacing in here, you can actually get a little more of an arch. If you squeeze a hand between the stick and the low back, you want to basically just get right past your fingers to the first knuckles. Okay? If you can't get your hand in there at all, they need to give you a little more curvature. And if they are completely flat and you can't even do that, you need to do that. Or if it's excessively arched, I'm sorry, I got that backwards. If it's arched too much and you can slide your hand through there, then you want to have them decrease that. So just to reiterate, you want to be able to just slide your fingers to the first knuckle. Now, maintain that position. The exercise is going through what's called a cross crawl pattern. So I'm going to have him lift his right hand and his left knee just barely off the ground. So go ahead. And they're going to hold that for 3 seconds. So 3 count, 1, 2, 3, drop, and then they're going to switch. 1, 2, 3. They only want to lift the hand and the knee just barely off the ground, high enough to slide a piece of paper under there. Okay. You want to make sure the patient is stable. If this is something that somebody's starting off with and they just got out of surgery or they have weakness, even though this looks like a simple exercise, it may present some problems. They may be very imbalanced when they do this. So the other added benefit of this exercise is to work on improving balance. All right? So let's lift your right hand and your left knee and just kind of get wobbly. Okay, so if they're having a hard time, that they just won't be able to balance, they'll want to put a hand or a knee down. Okay, so you want to try and get them to stay nice and steady, and you also want to make sure they keep that neutral curve in their low back while they do the exercise. All right, so this exercise will be repeated for 20 repetitions, 10 each side, and I'll usually have a patient do 3 to 5 sets of that exercise. Okay, great strengthening exercise. You're strengthening the glute, the erector spinae, and then as it transfers into the latissimus dorsi, those muscles work in a cross-crawl pattern when we walk or we run. So this is a beneficial way to strengthen your spine because you're strengthening it into a functional movement pattern.
Thanks for watching our video. I hope you found it helpful and informative. This is going to be one in a 3-part series. On the next video, we're going to move to the horse stance horizontal, and then the third video will be the horse stance dynamic. These are progressive exercises that will show you how to strengthen your spine effectively. Thanks for watching. Please like or comment below, and remember, if you have any inquiries and you want to learn more about our office, please go to our website, which is linked below. Thanks again. Until next time, yours in health, Dr. Bradley.